Assalamualaikum and a very good evening. My name is Shahinaz and together with me is my partner Fatimah. We will be presenting on our research project entitled In Vitro Study, Can Tocotrienols Stop Oral Cancer Cells RL-2-08 from Proliferating? Welcome to our presentation.
Before we go further into the presentation, I would like to emphasize on the significance of our study. As you can see from the database screening done on PubMed, Cochrane and ScienceDirect, it was found that there is not one study that is similar to our study that has been carried out. We used oral squamous cell carcinoma lines or RL-48 obtained from Cancer Research Initiative's Foundation, Carif. It was taken from the mouth and gum of a 79-year-old Sikh female without predisposing habits. Next, we will move on to the main focus of our study, which is the vitamin E, which consists of two categories, which are tocopherol and tocotrienol. Each has 4 different isomers, namely alpha, beta, gamma, and delta. Since the late 1980s, tocotrienol was given less attention because it was discovered later in the mid-1960s. For 30 years, all research are focused on tocopherol, where it was first isolated in 1936. Despite the growing research on tocotrienol, they are still confused with tocopherol. And lastly, alpha-tocopherol is regarded as the dominant form of vitamin E. The abundance of alpha-tocopherol has caused an oversight of superior properties of tocotrienol. Even some studies showed that tocotrienol was more effective than alpha-tocopherol. Unfortunately, only 3% of studies are conducted for tocotrienol isomers. Moving on to problem statement, the current treatment for cancers including surgery, radiation and chemotherapy have failed to completely put an end to cancer. Not only the costs for most of the therapies available are high, there is significant post-treatment morbidity and mortality secondary to recurrences. Our objectives are to determine the in vitro cytotoxicity capacity of alpha, beta, gamma, and delta tocotrienols on oral squamous cell carcinoma cells and to compare the cytotoxic effect among all isomers of tocotrienols.
Our research procedures start off with preparation of cell line, followed by subculture, compound preparation, cell counting, and lastly MTT assay. We prepared our cell line using complete media, then the cells were incubated approximately 2 to 3 days until it reached 70 to 80% confluency. The cells were checked microscopically daily to ensure they are healthy and growing as expected. Once the cells reach confluency, we subcultured the cells. In the meantime, we prepared our compound, which are alpha, beta, gamma, and delta tocotrienol by diluting them in the MXO. Then, different concentration needed for the study, which are 10, 7.5, 5, 2.51 and 0.1 microgram per ml were prepared using DMEM supplemented with 10% fetal bovine serum and 2 ml of penicillin. After we have subcultured our cells, we will do cell counting to check whether the cells are ready for seeding. So when the cells are ready for seeding, MTT reagents were prepared. The cells were seeded in a 96 well plate at a cell density of 3 times 10 to the power of 4, followed by incubation of the plate for 24 hours. Next step, the cells were treated with various concentration of tocotrienol and incubated again for 72 hours. After that, MTT reagents were added, incubated again for 2 hours and observed using ELISA reader. Statistical analysis using SPSS version 26 was performed using one-way analysis of variance ANOVA method, followed by 2 key post-hoc comparison tests to evaluate the differences in inhibitory concentration IC50 of tocotrienol isomers, with P less than 0.05 considered as significance for the study. Post-hoc multiple comparisons showed significant difference between alpha-delta and gamma-delta with p-value of 0.001 and 0.000 respectively as in the table. This is a 96 well plate containing cells treated with different concentration of gamma tocotrienol. As shown here, each well has different color intensity of purple, which is due to the reduction of MTT reagent into an insoluble and dark purple colored formazan after 72 hours of incubation, which is later observed with ELISA reader to measure the optical density OD value. For your information, high intensity of purple color meaning that there were presence of viable cells, as only viable cells are able to take up the dye of MTT reagent and produce the purple color formazan, while non-viable cell couldn't and will exhibit lower intensity purple color. As you can see, the purple color reduced from 0 to 10 microgram per ml. This is supported by the OD value shown in this table, where the OD value of gamma decreased from 0.1 to 10 microgram per ml, except for 2.5 microgram per ml, which is slightly increased. As a result, from above figure and obtained OD value, it shows that cells treated with higher concentration of gamma-tocotrienol exhibited the least intensity of purple color formation with low OD value, as observed at concentration 5, 7.5 and 10 microgram per ml, indicating the absence of viable cells, while lower concentration of gamma-tocotrienol exhibit more viable cells.
In relation to that, graph established that the percentage of inhibition of alpha-tocotrienol showed a linear pattern from concentration 0.1 to 2.5 microgram per ml. Then it increases at 5 before slightly decreases until 10 microgram per ml. Percentage of inhibition for beta-tocotrienol also exhibit a linear pattern from the least concentration of 0.1 up to the highest of 10 microgram per ml. For gamma-tocotrienol, more than half of the percentage of inhibition with 54.68 and 59.32% were demonstrated in 5 and 7.5 microgram per ml respectively. The graph also showed an increasing pattern with a sudden drop at 2.5 microgram per ml. The data also revealed the cytotoxic effect of gamma-tocotrienol towards RL-48 with inhibitory concentration IC50 determined at 7.5 and 5 microgram per ml. This suggests that gamma-tocotrienol exhibit ability to inhibit RL-48 cell proliferation. Thus, this indicates that gamma-tocotrienol may have potential anti-cancer properties towards oral cancer cells. From the graph, data tocotrienol showed negative values for percentage of cell inhibition, however, still portraying a linear pattern. Overall, the graph of percentage of inhibition against concentration of tocotrienol isomers suggested that almost all isomers showed a linear pattern, with exception for the sudden drop of gamma-tocotrienol at 2.5 microgram per ml. From our study, gamma-tocotrienol exhibit the highest antiproliferative activity, with percentage of inhibition of 59.32% at IC50 of 7.5 microgram per ml. This is supported by a study on human oral cancer cell lines B88, where the proliferation was inhibited by gamma-tocotrienol. The antiproliferative activity towards 3 different cancer cell lines mediated by tocotrienols only, with high gamma-tocotrienol percentage in tocotrienol-rich fraction TRF, and also antiproliferative activity of gamma-tocotrienol towards mammary cancer cells and human colon carcinoma, gastric and pancreatic cancer cells, and cervical cancer cells.
IC50 value of alpha, beta and delta were not determinable, meaning that the concentration of those isomers given failed to manifest 50% inhibition of the cells. For alpha-tocotrienol, a study reported that it turns out that this particular isomer is potent in neuroprotection rather than anti-cancer. However, alpha-tocotrienol does shows anti-cancer effect on several cancers such as sarcoma 180, early sarcoma and invasive mammary carcinoma, but has lower effect than that of gamma-tocotrienol. For beta-tocotrienol, the study on this isomer is rarely done due to its low abundance in plants, making it difficult to be extracted. Nevertheless, it is reported that beta-tocotrienol has anti-proliferative and apoptotic effect on human lung adenocarcinoma and glioblastoma. Increased beta-tocotrienol concentration causes reduction in cell numbers and increased cell death. Delta-tocotrienol, on the other hand, presented with negative IC50 value, which is contrary to our study, which aimed to find anti-proliferative effect. However, a study shows delta-tocotrienol to manifest anti-proliferative effects towards colorectal cancer, where it suppressed the cell proliferation and turns out to be the most potent towards colon adenocarcinoma cells compared to other tocotrienol isomers. Next issue that we'd like to discuss is regarding cisplatin, which is the present drug available to treat head and neck squamous cell carcinoma. Cisplatin is a well-known and highly effective anti-neoplastic drug, but the downside is cisplatin also has a few side effects such as ototoxicity, gastrotoxicity, myelosuppression, allergic reaction, and nephrotoxicity. Plus, it was found that cisplatin also causes toxicity towards normal human oral keratinocyte. Pertaining to this problem, a study was done on tocopherol, vitamin E compound, specifically alpha-tocopherol. In this study, alpha-tocopherol was proven to increase the effectiveness of cisplatin as an anti-tumor agent. It aids in tumor growth inhibition activity of cisplatin by increasing the influx of cisplatin into the tumor cell membrane. Plus, alpha-tocopherol is non-toxic on normal human oral keratinocyte, although it exhibits lower anti-proliferative effect than cisplatin. Thus, referring to this study, it is suggested that further study comparing gamma-tocotrienol with cisplatin should be done to observe the ability of gamma-tocotrienol as a potential adjunct to cisplatin.
In conclusion, our study suggested that gamma tocotrienol exhibit the most potent anti-proliferative characteristic towards RL-48. However, the possibility of non-specific cytotoxicity or specific anti-neoplastic activity of this isomer should be evaluated. Further study of anti-proliferative effect of tocotrienol isomers towards both RL-48 and normal cells should be conducted. These are our references. Thank you.